Good afternoon, dental internet world. My name is Dr. Vishal Sharma, once again here alongside my friend and co-host, Dr. Mike Parchewski. Mike, we have an interesting guest today. It's not very often that we are filled with fear and trepidation when we have a guest, but we have our boss. Technically, our boss is going to be our podcast guest. So, Mike, it's good to see you. I'm going to let you introduce our guest and fill us in on what you've been up to lately.
Great. Thanks, Vish. And welcome, Dan. For me, just a bit of golf, a bit of summertime, but still avidly working into the dentistry. I've just been not getting the breaks this summer that I was hoping to, but the weather's also been a bit rainy, so I'm also okay with staying indoors. Today, we are very excited. We have Dr. Dan Butterman with us today. He is a practicing dentist in Denver, Colorado, which is a fantastic place to ski. And he's a key opinion leader for Dentsply Sirona with a focus on implants. And as well, he's the Chief Dental Officer at Spear Education and Faculty Chair for CDOCS. And as Dr. Vishal alluded to, both of us are on the faculty with CDOCS, as me as a recent join, and very excited about it. So welcome, Dan, to our podcast.
Thank you. This is super exciting for me to join you guys, and I know all the amazing stuff you do. So what did you say? This is 48, 47, something like that? Is that
Yep.
Yeah, we're excited.
It took all of those people to get to me. If I would have been first or second, that would have been nice, but I'll take 48. That's fine.
Yeah,
well, the quality of our guests have been improving exponentially since podcast number 47. So since then to 48, it's been a big jump.
Yeah. So we'll go off. It's not desperation. It's innovation.
Obligation.
Yeah.
That's actually fair.
I don't know if that would make it on a bumper sticker, but to kick things off, can you tell us a bit about your journey in dentistry and what led you down this path to become the Chief Dental Officer at Spear Education and Faculty Chair of CDOCS?
Yeah, part of it was probably stupidity. Some of it was dumb luck. But it started 31 years ago when I started practicing dentistry, and my passion was clinical. That's what I thought I always wanted to do. And it was kind of a very similar story to probably a lot of your listeners and you guys as well, where I got sucked into the technology. I thought it was super cool. I really wanted to engage with it. And that was on the CEREC side. And so I just dove in deep on education. I attended everything I could. I got on CDOCS discussion boards, and I just really loved to engage with it. I came out and mentored workshops. And then it just turned into one of those things where it was just, I started to present in some workshops and started to do some other workshops with other groups outside of Dentsply Sirona, and it just kind of ballooned out from there. And like you guys, I was faculty for a lot of years and loved every minute of that. Had no intention of doing anything beyond that. And I thought, this is what I love doing, being in front of a room and still doing clinical dentistry. The idea of doing the corporate side of the business actually seemed horrible. Doing the administrative side and I had no interest in that. But then it turned out doing that gave me an opportunity to actually change the path or change the direction of the company and really kind of move things along a vision that I was excited about. So now I get the best of all worlds, and even better than that, I get to work with you guys. So I appreciate that very much.
Good plug.
Yeah, it's an interesting aspect. And I had a number of patients who've asked me over the years why I really like presenting and teaching. And I would tell them that if you have a really good experience today, it's a positive impact for one person. And when you take that skill set and you present to a room of 20 or 30 dentists, you're impacting 20 or 30 potentially, and you get that same positive feedback, but it's obviously exponential. And then obviously, Dan, I can appreciate your role where you're now driving education, where you're driving protocols and courses on for instructors, and then they're then taking that to scale that. That positive feedback, which is certainly a bit addicting, it can become, obviously, it's scaled multiple times over. So I can certainly see the appeal sprinkled in with some of the corporate frustration.
Yeah, well, and you're right. And I think that exponential touching of other people that really comes from not just the dentist that you treat, it's every patient or the dentist that you teach, but every patient that they see moving forward as well. So it's just really a lot of lives that you end up affecting. And to be clear, as far as me driving, this is a joint effort with this group, and it is very much co-drivers, co-pilots. And it's the thing I love the most about CDOCS in general, is that it is a very cohesive group, and it's a group that is very like-minded, and the passion is there among all of us. And so I think we all have a wonderful vision that we get to drive together with, which I love.
Yeah. And so speaking of that vision and kind of the future of educating dentists, how do you see that evolving, especially in this like post-COVID, increasingly digital world that we live in? Where is that progressing?
Everything changed. Like, if I'm being 100% honest, you could put on a workshop, drop, and it could even be you teaching it, Vishal. And then
It has.
Totally kidding. But like, what people would just come. I mean, that was just what you did. You got on a plane, you went, and you attended CE. And then when COVID hit, it made us understand that, we don't actually have to necessarily leave our office. We don't have to get on a plane. And so that kind of world, that virtual world, really took hold, and we see it in so many industries. I don't think that will ever leave dentistry. Now, hands-on will still be important, but I think we're kind of in a world now that really needs a hybrid type of education, where there's going to be when I want to come in and I really want somebody over my shoulder and I need that level of hand-holding. Wonderful. Otherwise, there's some stuff that I can get just sitting in front of my computer and just being a part of it in that way. So we've had to evolve, and that's been hard. It's been challenging, and also the way people learn is so different now. Gone are the days when you would find a mentor in dentistry and you would shadow them and follow them. Everything's TikTok or Instagram or 5-minute little clips, and people just don't have the time or the desire to invest huge chunks of time in learning now.
Speaking of over the shoulder and mentorship, your son has recently joined your practice. So tell us about that and how that's going, and what kind of mentorship you're offering, and most importantly, what things are you offloading to him?
Yeah, so the agreement was that he was going to not specialize and he would get right into my practice, but I kind of felt bad about that because I didn't want to really force him into general practice if he wanted to specialize. So I'm allowing him to specialize in hygiene checks and MODBL composites, and so he's getting really, really good at that. But no, in seriousness, it's been just so heartwarming for me. I'm a little bit of a practical joker, and I'd like to laugh. I like to have a good sense of humor. He takes it to the next level, which can be a little bit aggravating sometimes. As an example, just the other day, I introduced him to a patient, and she looked at him and she said, "Wow," because he's 6'1". And she's like, "Wow, I didn't realize you're so tall." And his response was, "I'm not so tall. It's just my dad's so short. So I just see that." It's like, those are the kind of things that happen day to day. So we just laugh and we have fun. But that mentorship it's a gift for me. Whereas if he wasn't family and it was just an associate, it might be a different level of frustration and attention and passion that I would give to it. But as my son, it's like, I just want to see him succeed. So it's a little bit different for me.
It's often nice to have when you can have one of your siblings or a child of yours join the practice. Many of the dentists, when I was at the Peers Conference in Charlotte, there's so many fathers, daughters, and partners and stuff like that, and it's the ability to share that as you move forward, and having someone come into your clinic is a pretty powerful thing. Both my daughters sports driven and dad's bank guard driven, so not so much dentistry driven, unfortunately. But given, let's dovetail just a little bit, but you talked earlier about the changing of education and how that has become different with that mindset that everybody has, including my daughters, that they need information quick and they want short snippets. How do you see like the new grads today that are coming out of dental school, and how do you see that, what they want to focus on, how we're going to educate them, and what their current needs are as they come out? What do you see those as being the big challenges for the new grads?
Yeah, and it really has changed. And I would argue that some of this is COVID as well. A part of it could just be the massive amount of clinical education that needs to be taught in dental school. But I think that probably most of us would agree that kids are graduating without necessarily the same number of procedures, the same amount of clinical experience that a lot of us had years ago. We're seeing kids come into workshops that after they've graduated, they did 4 crowns. They've not done a root canal on an actual human before. So we have this limited amount of clinical knowledge that's there. There's theoretical knowledge. And so what we're finding is that there are some gaps in some of the foundational learning. And I think that that's a miss because the stress and the pressure of a new grad coming in either to a private practice, a DSO, it really doesn't make a difference. The pressure is still on to perform and to have a certain level of production, and time and experience and tips and tricks and all those little pearls that we get. That's what makes us efficient. That's what kind of takes away that stress. And I think that piece is missing. And so we want to, on the CDOC side, but also on the Spear side, we really want to double down on that, maybe that 0 to 5 year dentist, that newer grad that just needs some help on the foundation piece, because I do think that piece is really important.
Yeah, it's good. That's good. And I also think there's a bit that I've noticed with some of the new grads that they come out quite confident. And I think some of that is coming from, they're seeing the YouTube, they're seeing the Instagram, they're seeing young dentists, getting right into implant dentistry and that. And I do think they are skipping over some of those fundamentals, which are really important. You've been really well known as the CEREC guy, amazing trainer. Some of my best lectures and learnings have been courses that I've seen you teach on implant workflows and CAD/CAM workflows. So right now in that world of CAD/CAM and CEREC, what is the technology or the updates that are coming that have you most excited as a clinician?
Yeah, I think like ChatGPT changed everything for our world, and it made us realize that the amount of work that we have to put into our daily tasks don't necessarily need to be there. And I think that sort of introduced the world to what the potential of AI is. And that probably has me the most excited because it's always been a little bit of a heavy lift. And it doesn't matter if it's CEREC, it's any sort of digital technology, any kind of software design, all of those things take a little bit of education. They take time. There's frustration associated with it. And I think that we're seeing multiple companies really shift into that AI approach, whether it's designs of restorations that are going to be almost instant and perfect. And then the clinical side from radiology and diagnosis as well. I mean, having a second pair of eyes to take a look at radiographs when you're busy and you've got a lot of things going on and you've got some AI software that's going to be able to point things out to you. So I think that's the thing that's going to become a little bit like ChatGPT, where we just lean on this AI support, whether it's from a design or a diagnostic approach. And we'll see a lot of that coming.
Yeah, I think that's great. That AI really, I think, coming into helping with restorative design has really made, even the proposals nowadays have gotten so much better than back in my RedCam days. But, like now, a new dentist coming into CEREC, that learning curve is so much less than it used to be. Hey guys, like what a difference that has become, that how fast now you can get somebody up to speed on that. Whereas back in the day, it was quite a bit of work. I know, sure. Vish still using his RedCam, so it's really quite good. But
can't get them upgrade, can you?
Yeah,
I'm a big believer in classical CEREC. So classical music and classical CERECs going all day.
Yeah, cigar and CEREC. That could be the next podcast.
But it's a good point though, Mike, that you make on sort of the evolution of the technology. And Dan, I would echo that. The thing that I find most exciting is what AI can do for the predictability and accuracy of dentistry, and how it can expand all of the cutting edge pieces of hardware and software that we have available, how it can make it more readily accessible to a much greater percentage of dentists. That to me is probably the most exciting component about being a clinician.
Yep, agreed.
Yeah. It's a lot of data, right? Right. We have access now to so much stuff, so much data that AI really, for me, is going to be how to harness all that data and make it digestible so that you can actually learn from
That's it exactly.
Yeah.
It is having something that can compartmentalize it and segment it for you and put it in a usable format, whether it's finding caries or looking at pathology on a 3D image or designing a restoration. I mean, it's all just crunching numbers and putting that data together in a useful way.
Yeah. Yeah. I've got a side question here. CDOCS and working with Spear has become such a leader in education and digital technology. How has CDOCS gotten themselves so established in North America as the place to go for education? How did that all come about?
It's interesting because it really started with the idea that we were going to partner with manufacturers, Dentsply Sirona, and we're going to partner with distributors, Patterson and then Henry Schein, with the idea that, hey, people are going to invest a lot of money in this technology, and we want to be able to get them up and running and be able to have success and use that. So the thing that got us most excited, and I think the thing that really pushed us forward, is that our education is Monday morning education, meaning that you come for 2 days or you come for multiple workshops. The intent is when you get back to your practice on Monday, whether it's implant restoration or implant placement or anterior veneers, the goal is that you're actually going to do that procedure on Monday. So there's a massive ROI when you take a workshop that allows you to do something tomorrow that you couldn't do today. And I think that piece of it really stuck with people and it resonated with people.
And pivoting on that, Dan, because that certainly makes sense. That was my experience going through the workshops over many years. I know Mike feels the same way. Most of our listeners and most of our cohort have embraced digital technology. But if we have a listener, or if you had some advice for a dentist who's hesitant to adopt some of these costly digital tools, what would that advice be, especially with someone who's maybe a bit more beholden to some of the traditional methods and technologies?
Yeah, and it's funny because I think what we define digital gets confused as well. And we sometimes forget how digital we really are. And I would argue that if you're taking a 2D digital X-ray, if you're using a computer for your charts, if you're taking intraoral photos, you're already doing some segment of it. So whether you choose to implement now or you implement later, it doesn't matter. You are going to be implementing just because the technology is there. It's better than analog technology in a lot of situations, and the cost keeps coming down. So the question I think a lot of people try to decide is, do I go all in and spend a lot of money because I just want to get a Mercedes and have the full package and be able to do whatever I want, or I guess a McLaren, depending on what system you're buying. But the point is, there are lots of easy entry points. Maybe the goal is, I just don't want to use GUI impression material anymore. I just want to be done with that. I just want to get good imaging. There's a ton of different systems on the market that's all it's going to do. It's going to image for you, be able to move along, whether it's wireless or wired, whether it's a Dentsply Sirona Prime Scan 2 that uploads to the cloud, or whether it's something wired to a laptop. They're going to be able to create a very quick image that can be sent somewhere else, and then you can grow from that and evolve into, well, maybe I do want to design. Maybe I want to manufacture, and manufacture, it could be milling, it could be printing. So it's just, you have to jump in somewhere. But if you don't collect that data, so for example, taking a digital X-ray, it's not that it's digital, it's that you have that availability of that instant information. And the same thing is true with a digital image. Once you have an amazingly accurate digital representation, there's so many amazing things that you can do with it that you just can't do with analog. So it's coming. I see it in dental schools. I see the growth pretty much everywhere now. And it literally is, what are you waiting for at this point?
Yeah, I think the aspect on dental schools, integrating it and educating on that, obviously it just allows students to become dentists. It springboards them into their career. They're already accustomed to that, so they're much more likely to invest in it. So, sure. Speaking of sort of that education, and you already touched base on the newer grads at 0 to 5 years is going to be a growth opportunity, to major focus in your vision. But pivoting over to the chief dental officer role, along with that 0 to 5 cohort which you're going to be targeting, what other big challenges are you encountering with this chief dental officer role? Being part of such a renowned educational institution.
Yeah, it's always difficult because what you want is to have education that's going to keep evolving, that's going to be growing, and that's going to be relevant to today's dentist. And it's really easy to say, hey, I made this lecture 10 years ago and these slides are great and the information is still relevant, and I'm just going to leave it alone and not change it. We're just going to teach these same principles year after year. Well, that doesn't really help you if you come to a workshop and you learn a principle, but what you're learning is not on equipment or technology that you have back on your office. It's hard to implement when you learn theory, but you don't see the same things that you're looking around when you're back in your office. So one of the things we're pushing hard with, and you're going to be helping a ton with this, Michelle, as well, is making sure that all of our workshops really speak to today's dentist, not just the theory and the philosophy. And we are very focused on moving away in some areas from single tooth dentistry, as we've been taught in dental school, to more holistic, where should the teeth be in the first place before I just start putting your crown on tooth number, I was going to say 18, but your audience won't know what that is. What is that, 3-7?
I think most of them are actually American listeners.
Okay.
I love your bilingualism that you can just pick it up like that. That's
wasn't
great.
that fast. There was a pause.
Yeah. So yeah, that's an interesting aspect, and that's kind of one of the challenges and I think hurdles that dental education needs to overcome moving forward is how do you take tried and tested methodologies that use more of an analog system and pivot that into something that appeals more to a generation that's so computer savvy.
Yeah, very much so.
Yeah. And I think this next question I wanted to shoot forward to you sort of touches on this because moving forward with education and that, what are the biggest pieces or what are the big changes you see coming down the pipeline with innovation? And, I'll maybe preface it with, something that I'm excited about is the facial scanning, right? Looking at the face scan, taking face scan, putting it over an upper and lower arch and doing exactly what you said, taking a look at the patient in a more holistic manner, looking at it, how we do implants from restorative down. Why don't we look at the patient from face inwards, right? Let's look at them as a whole individual. But moving forward in technology and what's coming down the pipeline in dentistry, what do you feel, besides AI and maybe the face scan, that will be the biggest innovation or paradigm shift that you foresee coming down the pipeline?
Yeah, I think obviously I don't have a crystal ball and there's lots of directions things can go, but I do think that there's a big push right now on imaging and safer imaging. And I think we're seeing proof of concept with MRI being used in dentistry, which I think is going to be really interesting. At this point, it's more of a proof of concept, and it's not something that anybody could actually afford or fit into their clinic. But we see that growth. And how cool would it be to have a super accurate MRI that has zero radiation and allows you to see if a pulp is inflamed in a tooth, never mind that it's necrotic. And I think we'll see that growth. We'll see that push on it. I think everything is becoming more cloud-based. I think we're going to start to see more and more that the machines you own in your office, the software you own in your office is becoming irrelevant. Those are, I would say, dumb devices that really all they need to do is capture data, and the real work is going to be online. It's going to happen in the cloud. There's no reason to be bogged down by a processor you have on your computer in your office when you can tie into supercomputers or a room of supercomputers that are doing the work for you. So things will get faster, things will get safer, they'll get more accurate. So I think every year people say this is the best time to be a dentist, but it's kind of one of those things where now things are happening at such a fast pace that if you don't like the way dentistry is now, you probably just have to wait 6 months and it's going to be completely different because it's changing so quickly, which is cool. It's intimidating for people because it's a lot and it's hard to keep up with, but it's pretty cool to just see the fast pace that we're moving along with now.
Yeah, and I know AI is just flying along, and I've been delivering a version of an AI lecture all over North America. And I, like Vish is doing coming up, he's going to be lecturing on SureSmile in Istanbul. I was in Istanbul a couple of years ago for an endo conference and talking about AI. And I've now have delivered that presentation and I have to rewrite it almost every time because that's how fast things are changing. When I first delivered it, ChatGPT was just out. So everybody thought I was like this soothsayer talking voodoo. And now that's all old hat. So I just find like, yeah, you're right. Like we're having to constantly rewrite, update, and keep moving forward. And one of the things I'm excited about with CDOCS is the having access to that culture of, other dentists and docs that are just at cutting edge and access to that information and being able to incorporate that information quicker for the dentists that I'm teaching is very exciting. Now, from the CDOCS perspective, maybe just for the listeners, what's coming out next in the Spear Education or with CDOCS? Anything coming up in the next, like for 2026 in education offerings that people should be looking out for?
Yeah, but if I told you, I'd have to shoot you, of course, because we have to be very careful about how we launch and information is moving forward. But in seriousness, that is a key focus, is that we want to make sure that we have growth in our workshops. We want to make sure that we're tapped into whatever's new and what is the right workflow to do for people, because it's not just one and it's not just tied in that you have to do things this one way. So I think what you'll probably start to see is a shift in maybe using digital technology as a hub of the office for everything, for case presentations, for treatment planning, for diagnosis. So we'll tap into a lot of that. And I think that you'll see a huge push in this marriage, as I was kind of describing before, between old school philosophy and theories that we know are tried and true, but implementing them with new, exciting, cool ways of getting there. So the push is really on, and our goal really is going to have to be to meet people where they are today. And that's hard because historically, as a dentist, especially when you're a new dentist, you think you're the best in the world, right? You have that state of happy ignorance. You have no idea what you don't know. And then you get punched in the face a few times and you figure out, wow, there's stuff I don't know. And you feel that pain. That can be a really discouraging and difficult process before you get to that point to seek help. So I think our goal is we want to be able to meet people where they are today, whatever level of education they are, from beginner to the most advanced prosthodontist that you can find or other specialists. And we want to deliver it with an education that meets their needs. It might not be getting on a plane and sitting in a lecture room for 2 days. It might be a hybrid workflow. It might be having things sent to you, having things virtually designed, having two-way communication that is virtual. So there's lots of really cool, exciting things that we're working on to make sure that we stay at that top of the game.
Yeah, it's an exciting time, not only in dentistry, but also from an education perspective. And as educators, we really have to pivot. As you said, I like that, where you have to meet people where they are, but also just to stay on top of all the new evolutions and offerings that are coming out. It's daunting, but it's simultaneously exciting.
No, for sure. And I do need to ask Mike in particular, was that a flex that both of you have been asked to speak in Istanbul and I haven't? I just curious if that was the reason that was thrown in there as a...
So Dan, I think the main reason is for Mike and I, we both just fly economy everywhere we go. And I know the last time we were on a call when you were on a flight, that looked suspiciously like business class. So that's
I don't know what you're talking about. I don't know what you're talking about.
Dan, this has been great. We really appreciate you taking time out of your busy schedule to be a guest on our podcast. Listen, Mike and I are both really excited about being part of your team moving forward and helping to drive some of these educational initiatives that encompasses a lot of the new technology that's coming out in dentistry. So thank you for being a great guest. And I think also thank you for being such a great pioneer and educator in dentistry.
Thank you. I appreciate you guys having me on and so excited to work with both of you.
Super. Yeah, thank you again so much. It was an honor to have you on, one of the gurus and one of my mentors. And of course, Dr. Vishal, always great to chat with you, also one of my key mentors. Thanks everybody for tuning in. Please click to like and subscribe. And for more information at Digital Workflow Dentistry, our Instagram handle. Take care, everybody.